Hello and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Judith Sears-Poisson and I'm pleased to be your host today. Our webinar is on examining the long-term impacts of cash transfer programs on low-income households. A growing number of local governments and nonprofit organizations across the country are experimenting with guaranteed income programs, often with the goal of supporting low-income families and individuals. In many cases, research on this latest wave of experiments is just starting to come out. In the meantime, there are earlier programs that can provide insights and context for the present efforts, and those are the ones we'll be talking about today. First, we'll hear from David Calnitsky, who is an associate professor in the Department of Sociology at the University of Western Ontario, and he received his PhD here at the University of Wisconsin. David will share his research on the Mincome project, which was a cash transfer program in the Canadian province of Manitoba in the 1970s. Next, we'll turn to Amorim, an assistant professor in the Department of Sociology at Washington State University. Mari will discuss her research on the Alaska Dividend cash transfer program, especially its effects on low-income parents and children. Mari is currently both an IRP Emerging Poverty Scholar and a Visiting Poverty Scholar. And then we'll hear from Randall Akee, who is a professor in the Department of Public Policy in the UCLA Luskin School of Public Affairs, as well as in the Department of American Indian Studies. Randy will share his work on increases in unearned income and children's outcomes in the context of Native American casino dividends. This webinar is supported in part by funding from the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation. But views expressed by our speakers don't necessarily represent the opinions or policies of that office or of any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from each of our presenters, we'll spend the last 15 minutes or so at the end for a live Q&A. You can type those in through the Q&A box. We did get quite a few questions submitted as people registered, so we'll be queuing some of those up as well. I hope you'll also feel free to participate through the chat. We love to have conversations going there. And I want to let you know that we do have closed captions enabled, so you can toggle those off on and off at the bottom of your screen. We'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. So with that, thank you again for being here, and we'll get started with Professor Calnitsky.
I'm going to try to share my screen here. Okay, can we see the screen here? Yeah, you can see my cursor. Okay. So thanks so much for inviting me to speak with you. It's really nice to be back at the IRP, albeit virtually. I did my PhD here. My office was on the 3rd floor. So thanks to Sarah for thinking of me and to Judith for inviting me and for organizing. So I'm gonna get right to it. I am going to talk about some of my findings from an experiment that I did my PhD research on, which was a 3-year guaranteed annual income experiment that took place in the 1970s in Manitoba. It was called Mincome. I'm going to explain the experiment, say why I think it was unique, and then touch on some findings. So what happens when you eliminate poverty? The big question in particular is always, do people goof off? I'm interested in other questions, but that really is the kind of standard one. And I'll try to get to some of the evidence here. Okay. So first, some details on Mincome. It was funded by the Canadian and Manitoban governments. Everyone in a small town of about 10,000 people called Dauphin, Manitoba, had the option to access about the equivalent of $22,000 for 3 years for a family of 4. Everyone was mailed one of these. There's also a randomized controlled trial portion of the experiment that takes place in Winnipeg and also elsewhere in Manitoba. And there you have, isolated individual or rather family treatment and then control subjects. That part is similar to the US experiments at the time, so New Jersey, Denver, Seattle, that people might be familiar with. The Dauphin portion is unusual in that it takes place within the setting of a whole community. I could be wrong, but I don't think we have other cases where a rich country tests a substantial guaranteed annual income at the level of an entire town. I think this is important because you can start to observe macro effects and social interaction effects that are just ignored when a small group of subjects are treated amidst a kind of sea of, non-subjects. Okay, so this is more or less the idea in terms of the experiment participants. Dauphin, it was called the saturation site or the community site. People basically receive Mincome amidst other potential recipients. So that means you're observing both individual effects and social or indirect effects together, right? You're capturing what I would say is the real world of social interactions, and that might matter. And then in the dispersed treatment elsewhere in Manitoba, there people receive Mincome, but live in sort of ordinary labor markets, and the same is true for the control. The Dauphin, so the saturation site, I think saturation in general or community level experiment might matter for a range of possible reasons. So consider one example. You might not drop out of work if you sort of get the treatment alone, but if others do, let's say a friend quits their job to go back to school, well, you might copycat, right? Or you could also argue one argument that was made at the time was that all of a sudden leisure becomes much more valuable if friends are also exiting the labor market. In a community experiment, you can start to get at more broadly some of these general equilibrium effects. You can start to get at changing norms. There might be a back and forth with firms, right? So for example, people might reduce work, but firms might then pull wages up. That could bring some people back in, right? Or alternately, people might work less at higher wages, right? You miss all of that, I think, in the sort of RCT context, and that makes them a little bit more, I think, artificial. It gives them a bit of a scientistic kind of quality. I agree with the general consensus that RCTs are the gold standard, but I do think it kind of depends on the subject matter, right? When the subject matter really is asocial, not social, right? As in lots of medical examples, that might be true. But I think that when you're interested in behavior, as soon as you admit that behavior kind of interacts in social context, then the RCT approach might start to miss a lot. So I think some people are going to be familiar with how this style of guaranteed income works. But basically, if you didn't work at all, the guarantee was about 22,000 for a family of four. That's the floor. That's about half of the median household income rather, in Dauphin at the time. And they were using a negative income tax of 50%, which basically means that if you go and earn $6,000 on the labor market, you keep that, and then your guarantee is reduced by 50%, half that, by $3,000 to $19,000, and you end up with about 25,000. And then the benefits slowly phase out. So everyone has a floor, and you're never made worse off by taking on some waged work, as in kind of the traditional means-tested welfare programs. Okay, just to start with work or labor force participation, this is admin data from the experiment. In a community experiment where people see other people adjusting to the program, they might adjust too. Social norms might shift around. Joining might take on less social stigma. So here we're comparing Dauphin before and then during the experiment to these Manitoba controls before and during. And you can calculate a kind of difference in difference, changes internal to the treatment, changes internal to the control. And I see a decline of about 11 percentage points. Here I'm adding in the Manitoba treatment. These are, again, people who receive Mincome, but are sort of dispersed across different Manitoba towns. And what you see is the community context has greater declines in labor force participation. Perhaps there's some level of social interaction, copycatting that's explaining some of the greater declines in Dauphin. Okay, so what were people up to? I think one of the big questions is what do people do if they're dropping out of the labor market? That I think matters for its sort of moral salience. There hasn't been a lot of work on people's non-employment activities under a basic income. One theory about basic income or guaranteed annual income is that our deepest desire in life is to relax at home. An alternate theory says that no, a host of socially valuable activities, care work, education, artistic endeavors, and so on, they're all going to get unleashed if when people's basic needs are secured outside of the labor market. So some of these questions are really not answerable given my data, but I think it's worth considering them briefly. So I have a paper that is more qualitative, and it looks at just some commentary from Mincome participants. Here you get some, I think, hints at what people were up to, why they participated. About 11% unprompted indicate that they withdrew from the labor market in one way or another. They emphasize using Mincome to help to go to school or to help care for family, not being able to work or disability, often not finding work, and so on. I have another more quantitative paper on this question, why people weren't working, but to save some time, I think I'm not going to go into this actually. I'm instead going to shift to one of the big questions that you can't really ask in a randomized control trial, which is the interaction with employers. Um, so this paper is on the interaction between participants and employers. How do employers respond? The basic question is, how do employers respond when the whole labor force, especially the bottom end, has access to a basic income? One of the surveys that Mincome conducts and then archived is this survey of businesses pictured here. It was a kind of census of businesses. It was sent to every business in Dauphin and then in 7 control towns at a baseline and then during the study. Again, you can't ask these kinds of questions in an RCT. The program will just be imperceptible to employers. Here, employers may notice when all of their workers can potentially avoid work. Okay, so there's 2 basic theories on this question. The first suggests that worker exit power will force wages up, right? Perhaps labor markets tighten. And the second theory says no, we expect government supplements can allow firms to actually lower wages, right? Is it really just an employer subsidy, as some argue? This is so the survey had a little bit of room for qualitative commentary. This is a bit of a hint of the answer. Most of the commentary here is empty, but from what you do see, the comments that are there, employers really don't seem to like the program. I'm not going to read this out loud again in the name of saving some time, but I'll just show some of the results quickly. So these are just descriptive statistics. What I find is a big increase in median wage offers in the Dauphin context. Their wage offers on job vacancies on the part of Dauphin firms go up, no real change in the control towns. This is another slightly different question. This is wages on new hires, which grow faster in the Dauphin context. In the control, they basically just keep up with inflation. And one part of the explanation might be a tightening of the labor market and a decline in firms receiving applications. So the question asks, did you have any applications to your place of work? Bigger chunk say no in the Dauphin case. And fewer applications might have then meant fewer new hires, right? So how many new people were hired in the last 4 months? A bigger chunk saying none. So it could be that having an exit option from the labor market to some extent improves worker power. Okay, I'm not going to go into this either, but I have another paper on reduced violent crime in the Mincome years in Dauphin. I'm instead just going to conclude. I'm assuming I'm towards the end. Yeah, okay. So the last thing I will say, or the big question is are the findings that I have are they good or bad? I think that just depends on what you value, right? So I think rarely in these experiments do people say in advance what they would see as a desirable outcome. I don't think people are sort of rarely calling their shots, I think. Some people will say that the only good outcome is no change in work. I think that a basic income or a guaranteed annual income that really does make wage work optional for some people or strongly raises the reservation wage, it might mean that some people work less in formal labor markets. But it might also improve worker power and wages for others, which I think is desirable. I don't see business getting on board with that, but on the other hand, it might be popular as Mincome was. So personally, when it comes, when asked about my own values, I think we ought not force people into labor markets on pain of starvation. I think leisure ought not be the sole province of the rich. But so long as the decline in work and the growth in wages is not so much as to undermine the whole program, then I see it likely as good. You're giving people more freedom to do what they want to do in life. If you don't have any work reduction, you're not lessening toil, but you're also potentially not activating socially valuable activities. You're not expanding people's freedom, which for me is the whole point. Okay, thanks. I will turn it over.
Okay, hi everyone. I'm going to share my screen here. Okay, I'm really excited to be here today talking about the Alaska Permanent Fund Dividend. It is my understanding that a lot of people may not know what the dividend is. So I would like to start with a little bit of background on this program. So back in 1976, the Alaska government established a permanent fund that receives a share of the revenue from Alaska's natural resources. Sorry, I'm having Okay, got it. Okay, and then in 1982, the legislators create the PFD, which is a dividend that shares this wealth generated by oil with all Alaskans. The PFD was never meant to be redistributive or to alleviate poverty in its origins, but the legislators at the time created a hold harmless provision so that the PFD would not count as income for eligibility purposes in certain assistance programs. The other thing that I want to emphasize about the program today, if you're curious and go read about it, you're going to realize that more recently, as the oil revenues have declined in Alaska, the state budget has also decreased. And as a result, the state has relied more and more on the permanent fund reserves to fund the public services. And that has created a certain amount of tension or competition for resources in terms of funding the dividend and other public services. I'm not going to get into this in the talk, but it's a really interesting point that you will find out there, and I think is of interest for this audience. What I want to emphasize is that today, the PFD is the closest thing that we have to a universal basic income in the US. And it's actually the longest running universal cash transfer program that exists. It's not a pilot. It's not, targeting just a small group of people. It is something that has been implemented in the state level for over 40 years. So what happens in Alaska is that in every October, nearly all Alaska residents receive a payout that is universal, unconditional, individual, and large. By individual, I mean that each Alaskan resident, including toddlers and infants, receive a check on their name. So a family of 4, right, if the payout of that year is $1,500, would receive $6,000 in October. This is also a saturation treatment in the way that David was talking about, in the sense that everybody around you is receiving the same treatment that you are. It does not vary by income. And there are some people who do not receive it. And I'm not going to get into the details about eligibility, but like 95% of Alaskans will receive that payout. I know that the audience here is really diverse and there is interest in a lot of different outcomes. So before I go into my research, I want to summarize what has been found to date on the literature, specifically on the Alaska Dividend, which is not a very large literature, surprisingly. So this table here has all the outcomes that I know that have been published looking at the PFD. And as you can see, the PFD has decreased the incidence of a bunch of outcomes that we do want to decrease, such as property crime, child maltreatment, mortality, and childhood obesity. It has also increased a bunch of outcomes that we potentially do want to increase, like fertility and breastfeeding and voter turnout. There is some research showing that the establishment of the dividend had some initial impacts on some outcomes that later faded over time. And then there are some outcomes that we have no impacts at all. And I want to highlight here, just in comparison with David's talk, that people who have looked at impacts of the PFD on employment have found that it does not impact employment. It has only increased a little bit the share of part-time laborers. And I can answer more about it in the Q&A if people are curious. But anyway, with exception of increases in substance abuse incidents in the month after disbursement, really this table shows a pretty positive and beneficial picture of the impacts of the PFD in Alaska. There is a little bit of a puzzle in the literature that I want to mention. Berman has documented in 2 separate papers that the dividend does decrease poverty in Alaska by a lot since its implementation, particularly among the most vulnerable groups. However, in other research, Calnitsky and Bayek find that the dividend contributes to increasing income inequality over time. And this is a little unexpected in some ways, right? This payout alleviates poverty. It is a greater share of the income of poor families, yet it's increasing income inequalities. How does that happen, right? So a potential explanation for that comes from how people make economic decisions with that money. Imagine that if, for example, all low-income people that receive the PFD splurge and waste their money, and all the high-income people who receive the PFD invested to get more returns out of it, right? That would be a potential explanation for why inequalities in income would increase, and it would be in line with a lot of stereotypes of poor women in welfare roles, right? Think about the welfare queen tropes. However, research on consumption does not support that at all. Kuang has done some research on this, and he finds that it's actually the high-income individuals that increase their propensity to consume after receiving the PFD, and that they are potentially splurging on non-durable and services at that time. I was personally more interested in the economic decisions of parents, right? For 2 reasons. First, there is very little research on children's outcomes as a result of the PFD out there. And parents' decision can be a really important mechanism through which that payout really benefits children. The other reason is that parents' decision can really shape the transmission of inequalities from one generation to the other. So I kind of followed Kuang's template, but looked at parental spending after receiving the PFD, and not always spending, but spending that's targeted at children, right? So in this particular paper, I also do not find support for the notion that low-income parents may be making bad decisions with the PFD money. In fact, I find that low-income parents are more likely to spend in ways that benefit children after receiving the PFD, right? However, this spending only increases in the very short term. And when we look in the long term, it's like that spending dissipates over time. So we don't see any aggregate increases over the course of the whole year. This study was not satisfactory in answering the inequality puzzle, and not even in giving us a really good picture of how the dividend can shape children's outcomes. So as a result, I got together with a student at the University of Arizona, and we spent 3 years interviewing parents of all income backgrounds about how they use the PFD. And here I'm going to focus mostly on low-income parents. First, I'm going to emphasize the 3 key findings that we had that I think address a little bit children's well-being and this kind of puzzle on inequality. So the first thing that we find is that for low-income parents, the PFD, even though it comes once a year and is a lot of money, is not seen at all as a windfall. In fact, even the check that comes in their children's names is seen as part of the family budget. Here is a mom that explained to her child that his check is your rent money. That's the money that we're using to survive over the year. Also, we found that the importance of that check is much bigger for people after they become parents than before, right? In our sample, many respondents explained that they blew through their checks when they were young, but that the cost of children and the life choices that they made to benefit children, such as reducing work hours, right, meant that that particular phase of life required really careful budgeting. Here's a quote from a dad that said, well, as a kid, as a young adult, I thought it was cool, free money, you know, woohoo, I don't have to earn it. As a young parent, I thought it was essential, and it helped me provide many things that the paycheck could not. A little spoiler here that you may know, and I'm not going to get into high-income people and how they use their money in this presentation, but affluent parents are much more likely to save the PFD, at least their children's PFD in college accounts, right? And low-income parents don't do that. But we find that that's not because of a lack of interest or wanting or caring for their children on the part of low-income parents. It's just that the PFD amount, no matter how large it is, it's just not enough to support long-term savings because these parents are exposed to so many instability and insecurity throughout the rest of the year. And this inability to save the payouts for their children's future actually comes with a lot of guilt and embarrassment. Here's a quote from a mom that said, I can recall in the past, a coworker asked me, you put your son's PFD in a college account, right? And I think I was embarrassed to say that I was not giving him his money because it was money that we needed or counted on for general finances. And I was embarrassed to say that I was using his money to pay the bill. The third thing that I want to highlight about our findings, particularly as it comes to low-income parents, is that the PFD does have many positive impacts on those families and on those children's lives. It certainly increases children's access to material goods and their material well-being, right? Access to food, housing, safe transportation, clothing, materials for school, etc., right? Here's a quote from a mom that said, the PFD helped our quality of life. And it's also helped my children stay warm because it's, you know, I have many years counted on the dividend as that being the time where you get the kids all their winter gear, from boots all the way to hats and gloves that they lose 6 pairs of throughout the winter. Right. And the second thing is that it's not only about material well-being, but the PFD also has intangible social and psychological benefits to those parents and children. It promotes better relationships, it lowers stresses, it creates access to middle-class experiences that they both cherish a lot. And this is in line with a lot of research on the EITC in the US, for example. So here's a quote from a mom that says that when the PFD comes, we just do some things that we like without worrying so much. My kids have this yogurt drink that they like and is real expensive. When we have that money, I let them pick some at the grocery store. I don't say no this one time. My key takeaway when I look at how parents, low-income parents spend the PFD money to benefit themselves and their children is that the PFD can really alleviate poverty and allow low-income families to get by. But it's very different than what it is for the high-income families that receive that money. It is not the icing on top of the cake that they can put away and not think about for the next 10 years, right? So I guess what I want to emphasize is that there are real constraints in how low-income parents can maximize their use and the benefit that they can generate from a lump sum large cash transfer when they live in a context of widespread insecurity and economic inequality. And thinking more broadly, not only about my research on spending on children, right, but about all this other research that's out there in the PFD that I covered very lightly, I want to emphasize some takeaways that I have at least, right? First of all, there are a lot of benefits to having a universal and unconditional cash transfer. Like David was saying, this saturation creates some different kind of outcomes than what we would see in small experiments. In the Alaska context, what we see is high levels of support for the dividend across the socioeconomic spectrum and political spectrum, right? The dividend also has a much more simplified and cheaper administration compared to means-tested programs. It alleviates poverty and material needs for Alaskans. It also has flexibility to address the family's needs and what they consider important, which is very different than in-kind transfers, for example, right? And it does have beneficial impacts on a myriad of outcomes, right? As that table in the beginning showed. However, there are also some important considerations to keep in mind. In a context that's really marked by a weak social safety net, a lump sum 1-year cash transfer cannot be miraculous, even when it's very large, right? My own research, not only on child spending, but also on breastfeeding, and then others' research, for example, the article on childhood obesity, they suggest that people can better maximize the uses of these payouts if they already have some baseline resources to sit on, right? People with no or very little baseline resources have their hands tied in benefiting from those payouts. Particularly in a state like Alaska, where there are important trade-offs in funding the PFD versus public services that target low-income populations, this is something to consider, right? So overall, this context of insecurity and lack of social support may be part of why some of the impacts of the PFD in the existing literature are actually really small. And also why I think there's potential for the universality of this program to have some unexpected inequality producing results. I think I'm going to leave it here. Thank you.
Everyone, can you see my screen? Great. So I will. Okay, great. So I'm going to talk to you about increases in unearned income and American Indian children's outcomes and looking at cash transfers during adolescence. So this actually builds on some of the two presentations before in a sense of it's a long-term examination of cash transfers. So this is actually it's a series of 5 papers. I'll really be talking to you about the very first one here, Parents' Incomes and Children's Outcomes from 2010. At the very end, I'll summarize some of these other outcomes, which again were nicely, which align actually and accord with some of the previous research output results. So this study is the Great Smoky Mountain Study of Youth, and it was a longitudinal study that was designed to look at the mental health outcomes, psychopathologies of children in rural and American Indian communities in Western North Carolina. It was started in the 1990s with 3 age cohorts of children that at the outset were 9, 11, and 13. And it's representative of children in these, I think it's 8 or 9 counties. It's about 1,400 children, and they were followed over 8 years and then ultimately extended into today, into their late 30s. There's an oversample for American Indians, and the sample at age 21 is still about 80%, and that attrition is not related to any observable characteristics. But the intervention that I look at and others have looked at that a casino opened up on the tribal reservation, and as a result of that, by 1996, the tribal nation provided cash transfers from the revenues of the casino operations to all tribally enrolled members of their tribe. And again, kind of like what Mariana was talking about earlier with the Alaska Dividend, this income is distributed without regard to household characteristics or labor force employment. All that is required is being an enrolled member of the tribal nation there. And the amount that ultimately, especially over the time period that I'm looking at, which is the late 90s, 96 to about 2000 at the outset, the income presented represents approximately 20 to 25% of the average household income in the region at the time. So it's a really sizable amount. And you should also think of it as kind of a permanent income change because it had sort of been foreseen as that sort of an ongoing payment. There are lots of constraints here, and some of the most important ones, again, sort of raised a little bit earlier, is what the impact of this additional household income would do to labor force participation, also sort of family status. And because we have longitudinal data from prior to the casino opening as well as after, and we have characteristics of the household, not just the child themselves, we're able to show that there's actually no change in parental employment. We don't have very detailed information. We have things such as, full employment, partial employment, part-time employment, and no employment. So there might be sort of a modification on total hours worked, but we can't see that at least in the data as it's was collected. But nevertheless, we don't see big changes in parental employment as a result of the change in the household income. Well, again, this is consistent with some other research that I think Mariana has highlighted, but others as well in other circumstances. We also don't see any change in marital status. We don't see sort of dissolution of families, and we don't see, new family formation as well, new of the same population, right? So that's what kind of matters. That's not going to explain the outcomes that I'll show you shortly. And we just do a very simple difference in difference analysis. And really the idea there is that we're comparing results between the youngest cohort of children, the ones that I was mentioning that were age 9 at the time of the start of the casino transfers, to children who were 13 originally, because the youngest group lives in a household with increased household incomes for 4 years longer than that random group. And so we have one dimension of difference. And the other dimension of difference that we have is we have non-American Indians as well in the surrounding counties, and they're not eligible for the cash transfer. So we have this 2 dimensions across age cohorts and across these 2 different populations. And that's basically the formation of the analysis that we'll do here, and I'll show you some results coming up. So the way to read these results here are one of the results that we looked at were educational outcomes for the children. Here in the very first column, years of education at age 21 for the youngest cohort relative to the older cohort, and coming from an American Indian household. By age 21, they had about 1 additional year of education as compared to the control group. And I'll bring your attention to the category up here. These are households that prior to the casino opening were in poverty. So this is results concentrated on, I'll show you the next 3 columns, 2 columns, what happens there. But we also looked at another outcome, which is the probability of being a high school graduate by age 19. So again, the children from the youngest that were youngest when the casino operations began and the cash transfers began are about almost 40% more likely to be an on-time high school graduate if they come from, again, the youngest age cohort and are American Indian. Now, if we look at the next 2 columns, if we look at households that prior to the casino opening were not in poverty, we see that the effect is negative and small for years of education, and it's positive but small and not statistically significant for probability of high school graduation. So again, what I think this is showing is that the extra unearned income is having the most effect for the households for which it has the biggest impact, those who were previously in poverty. And we're seeing the effects concentrated in that subset of the population. And you can see the sample sizes down here. It's about 40% that were approximately in households were in poverty in these communities prior to the casino operations opening. I have other outcomes here. Committed any crime. Again, the youngest cohort seems to have a reduction in criminal arrests at ages 16 to 17, and not nearly as much in the older years. And so, I'll summarize some of these results that we have from this paper. We see high school graduation, specifically for those people, households that were in poverty, increases by about 39%. Years of education at age 21 increases by about a whole year. The next set of results aren't necessarily for those in poverty. They're sort of more the universal basic income outcomes. But we also see voting probability of the children, again, on average, all of the children that were treated to this household income, unearned income, increases in adulthood by 10 to 20 percentage points, depending on how you, the subsamples you look at. We also, because the survey is intended to measure psychopathologies, emotional, behavioral disorders, we can see other types of outcomes. And we see that behavioral emotional disorders decrease by age 16. We also see, because we are able to follow the children into adulthood, that in adulthood, we see that they also have improved mental health outcomes relative to, again, the less treated, the lower treated cohorts of American Indian children. And then finally, we have some information on parents during the childhood years of the survey. And we do find that there's some evidence that there's some reduction in parental fighting between spouses. There's even a reduction in, again, self-reported, but also reported for the other parent, drug and alcohol abuse and use. And so, again, this may point to some of the mechanisms through which the beneficial child outcomes are occurring. It might mean that, I said earlier, we didn't see a lot of evidence of a reduction in the time spent. We didn't see a lot of reduction in employment, but it might mean that it's not a quantity effect, but really a quality effect. Parents are less stressed. They're less, worried about finances, and the time they have with their children are more higher quality. And that might be the way in which that translates into the better observed child outcomes that we observe, and the better mental health outcomes that we observe for the children as well. And with that, I'll stop.
All right, thank you. Wow, for 3 really interesting and informative presentations. I think you all built on each other's work really nicely, and we do have quite a few questions in the Q&A. I have some of my own and some that were submitted earlier. So kind of pulling together a few questions that had been posed. I'm interested in how, what you all have been able to tell about how people think about this money. So I'm thinking Mari and Randy, they know it's coming, but I believe in both the Alaska Dividend case and casino dividends, the amount fluctuates year to year, depending on what the income is. And David, in Mincome and in many other guaranteed income programs, it was for a limited time. And so folks knew we're going to have it for this many months and then we won't. Have any of you been able to discern how knowing that either the amount is going to change or the time is limited affects decision making on how to use that money?
I can go first very quickly. Thank you, Judy. So with the Alaska Dividend, there was a formula that used the average revenue from the permanent fund in the past 5 years and got 10% of it and distributed it across residents. So people could calculate kind of what it was going to be and project in the future fairly accurately. By March, people, like all over the news, you would have estimates of the PFD that were very accurate. So people would plan based on that. Since the revenues of oil have decreased, and particularly since 2015, they have deviated from the formula, and there is a lot of political conversation and negotiation about how much of the fund is dedicated. So the amount became less predictable. And my understanding is that people in Alaska feel like they can rely less on that money, and it's changing how they use it, right? Like how they plan for it.
David?
Well, I would just speak to the time effects that you mentioned. This is a sort of standard kind of criticism of some of the basic income experiments that have happened more recently and the ones from the 70s. I think that the sort of 3-year length can generate different kinds of biases, right? And they might be cross-cutting. So some people will say that in reality, you'll get more work withdrawal. And that's because, people know that it's going to end and they'll eventually need their job, and so they won't quit, right? That's one view. The other view will say, no, in reality, you'll get less work withdrawal, right? Something like Mincome, there's one old paper that basically says Mincome is like soap, and when soap is temporarily on sale, you buy more. So the idea is you're putting leisure on sale. In that sense, right? You want to buy now. If that's true, the experiment will give an overestimate. But another way to, so it's also true, though, that there were longer term experiments. One of the experiments from the 70s was at least planned, and participants thought it was going to be a 20-year experiment, even though it ended up only being a 9-year experiment. And those results are pretty similar to the other ones. So it could be that the sort of time-related question is a bit overhyped.
And I'll just jump in and say that for the PFD has been in place for 40 years, and we find no impact on labor force participation. But it may be part because the amount fluctuates so much and people don't feel like they can count on it, right?
Randy, did you want to add anything, or should we move on to another question? Okay. There were a few questions. Again, I'm going to try to pull some together. Looking for whether there's any evidence that cash transfer programs like the ones that you all have been discussing can help reduce domestic violence or child abuse or neglect. And David, I know that was a question that you were happy to answer.
Yeah, well, I have a paper on the topic in the case of Mincome that I did with Pilar Gonalons Pons. So we looked at basically aggregate crime data, property crime and violent crime, and we compared sort of the Dauphin case to other similar sized towns in Manitoba and Saskatchewan. We find a decline in during the Mincome years in both violent crime and property crime. I showed a graph at the very end of the violent crime trends. The violent crime effect is a good bit larger. The property crime effect might be sort of more intuitive. You're just kind of changing the cost-benefit analysis for people. So we weren't entirely sure what might be going on. We still don't entirely know, but we suspect that it is domestic violence. If you look at some of these Statistics Canada reports at the time, we're trying to see what the kind of violent crime effect was, and they say that a lot of it was likely to be domestic violence, and that could be what is declining. We have a separate paper that's trying to look at some possible mechanisms, and we have a survey of married women who and sort of we compare with controls at a baseline and then during the study. And there are a couple possible mechanisms. One is financial stress. So insofar as Mincome reduces financial stress, you might reduce the risk of conflict and violence, or the incidence of violence. Another possible mechanism is that the guaranteed annual income could mean that women in potentially abusive relationships have a greater opportunity to leave and collect payments as single person households. And that would just potentially reduce the actual exposure to violence. And then another sort of version of that mechanism says you don't necessarily have to leave, but it might sort of, the possibility of leaving, the threat of exit could change bargaining power in relationships. We don't really find evidence for the latter two. It looks like there are somewhat more separations in the Dauphin case, but we don't find a statistically significant difference. We do find some support for the financial stress argument. Fewer people are pointing to arguments that they've had over financial questions in the home.
Sorry, I keep forgetting I mute myself. Mari or Randy, anything about child abuse or neglect findings?
So I'll talk a little bit about some of the results that we have found. We had lots of information on, again, child's well-being and their mental health and their and I mentioned a little bit about sort of the parental fighting as well, and we saw that those went down. We also saw that drug abuse and addiction in the parents decreased significantly, statistically significantly. And so, again, the issue of sort of fighting and parental strife, it seems like, again, when you alleviate perhaps one channel through which fighting might, again, conflict might occur, it might, again, this being financial, of course, it might help to reduce this overall. I don't think we weren't able to look at other aspects of child abuse, and our sample was, again, relatively small. But there was at least some indication that, again, relationships, parental relationships with each other, also with the children, improved. So the surveys asked both the parents independently and the children independently what the relationships were with each other, and both simultaneously or at the same time after the start of the cash transfers, both were improved as well. So some, again, suggestive evidence that relationships are improving.
Great. Mari.
I'll just say very briefly, there is one study that was not conducted by me on the PFD suggesting that it does decrease reporting to CPS when for maltreatment of children aged 3 if families receive PFD before that age. And I tried to look into domestic violence using data for pregnant women only, and did not find an effect. But that has not been published, and there is a lot of limitations. I don't make much of it.
Okay, thank you all. There was a kind of a basic question that I think is really interesting, because I think different subgroups of a population might have different access. How are each of the programs that you are studying and discussing, how is the money distributed? Is it through the tax system? Is it through a check? Is it a direct deposit? How do each of these populations receive the money? Randy, do you want to start?
So my understanding is that it provided twice, broken up over the year, every 6 months, and they're just checks. One interesting part is that again, you just have to be a tribal citizen. So you could live in Los Angeles and not in North Carolina and still receive the cash transfer. So, again, our analysis was restricted to the geographic region because of surveys. Mm-hmm. But there is a case that, I and some others are doing some additional analysis using nationwide data for other American Indian, the universe of American Indian tribal governments, to look at whether or not these cash transfer effects have impact on someone who lives off reservation lands, for instance. So, but anyway, the point is that yes, they're done by simple checks.
Great. And Mari, how is the Alaska Dividend distributed?
But this is really interesting. Most of it is direct deposit nowadays. The Alaskans have the option to mark a checkbox when they are applying to ask that the money, either in full or 50% of it, goes straight to a 529 and never hits their checking account. So that's also an option that many Alaskans, particularly higher income Alaskans, use.
Great, thank you. And David, of course, the Mincome program was before a lot of the current technology that gets relied on now. How was it distributed?
Yeah, it was a check also. Yeah, every month. Yeah.
Great. Well, we have a really big question that I think is very interesting, and I'm just going to throw it out there. Question for all three speakers. Given your expertise in this topic, if you were asked to advise on designing a national UBI or MGI program meant to reduce poverty and inequality specifically, how would you do it? And then the really big question, how would you finance it? Mari, I'm going to call on you.
Oh, that's a difficult one. Washington State also has a model of permanent funds, and there are now proposals being floated of doing something like what Alaska is doing, since they already have permanent funds and they can use those revenues and just distributing wealth from the state to everybody. So I think the way that Alaska is doing is a good idea. It doesn't necessarily work for every state. I like the lump sum distribution, but I was actually typing that in one of my responses to somebody in the audience. I think lump sums have a lot of benefits in terms of allowing people to make big purchases and even to save money. But that's only true if people have stability throughout the year, right? So I think in the absence of stability, like economic stability and decent wages and all of that through the year, I can see the benefit of monthly disbursements to allow people to just get by more easily and purchase what they need without that throughout the year. Those are my two big things, I guess.
Well, and hopefully we'll learn more as research continues to come out about the COVID expansion of the child tax credit, where there were monthly distributions and then also the tax time one. So, so a little bit of both. And it seems like I'm sure it would be a lot more of an administrative headache, but it would be nice if people had some agency in deciding what worked best for them and their family.
Yeah, research on the EITC actually, this question was asked over EITC recipients, and people seem to prefer lump sum. So,
All right, David, how would you design the ideal program?
I don't know. It's too big of a question. I can't give a good answer. I like universal basic income a bit more, I'd say, than the negative income tax, guaranteed annual income kind of approach, mainly because my sense is that the popularity effect is really powerful in terms of the political stability and the sort of long-term robustness of the program. That's just basically you're getting buy-in from everybody, and people will start to consider it a kind of right. It can potentially become a sort of third rail in politics in the way that universal healthcare programs often do in rich countries, right? They get introduced and then they're never repealed. Of course, it's much more expensive. The universal basic income is going to be much more expensive, at least up front. It's not necessarily going to be more expensive on net. It's just that you have to tax it all back, as opposed to basically giving out less in the sort of negative income tax approach, right? So the question is a little bit ex post versus ex ante, right? You're doing an income test in both cases, but do you get the money before the income test or in a universal basic income or in the universal basic income approach, you're getting the money before and you're doing an income test still, which is just called tax time. And we're collecting the money back, but there's going to be a lot more churn. My instinct is that that approach is potentially more popular. And then the kind of classic argument in the poverty literature, which I still believe, is that if you have that sort of popular, robust kind of program, it's going to ultimately be a better, sort of more effective anti-poverty tool.
And Randy, we will give you the last word.
So thanks, everything everyone said. And I think the child tax credit, sort of proved that, we could reduce child poverty by 50%. So something that was a little bit more targeted, I would not be opposed to something to that extent. And I'll stop there. Thank you.
Well, we are at time. I want to extend my thanks and thanks for the hundreds of people who are on this webinar to David Calnitsky, Mariana Amorim, and Randy Akee for sharing their time, their experience, and their research with us today. Thanks to Natea Taylor for handling the tech for the webinar. IRP is actually going to be producing some more materials, some policy briefs, podcast interviews, maybe another webinar about guaranteed income programs, looking especially at some of the newer ones. So please stay tuned for those in the coming months. As I mentioned before, we'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. Thanks again for joining us and have a great rest of your day. Take care.